Well, the Health Secretary, Matt Hancock, joins us now. Indeed, good news, a second vaccine now online. This is the news that we were hoping for.
Absolutely. This is really fantastic news this morning that the Oxford-AstraZeneca vaccine has been authorised for use by the regulator. They've been looking very carefully at all of the information that's come out of the trials, and they've approved it for use, which means that we can accelerate the vaccine rollout, which is much needed. And the NHS has done a fantastic job over December in making sure that the Pfizer vaccine can be used right across the UK, and especially focusing on the over 80s and those in care homes. But this Oxford-AstraZeneca vaccine is really good news. We have 100 million doses on order. The rollout will start on the 4th of January and will really accelerate into in the first few weeks of next year.
And how many vaccinations will you be able to guarantee by mid-January?
Well, that depends on the manufacture of this vaccine, and manufacture it's a challenging process. It's happening partly here in the UK and partly on the continent. So we're not putting a figure on the exact number, but what I can tell you is that we can now accelerate the vaccine rollout. Because we have the two vaccines, we can go faster than previously, and also because this Oxford-AstraZeneca vaccine doesn't have to be kept at that ultra-low temperature, it means that it's easier to distribute, for instance, in GP settings and in care homes. It only needs to be kept in a normal fridge temperature rather than in the super deep freezer. So it's very good news for accelerating the vaccine rollout. And of course, the vaccine is our way out of this pandemic. So it brings forward the day on which we can all get our lives back to normal.
You're saying that you can't project a figure in terms of the number of those to be vaccinated, but the medics are saying that really we need to be vaccinating 2 million people a week to prevent a third wave and to make any inroads into combating COVID-19.
Yes, well, the NHS stands ready to deploy at pace, at the sort of pace that is needed to be able to help us to get out of this pandemic by the spring.
That 2 million target surely must be what you're aiming for, if that's what the medics are advising needs to be reached.
Well, it depends on the speed at which the vaccine can be manufactured, and that's why I'm not putting a number on it. But what I can tell you is that depending on that speed at which this incredibly important substance can be manufactured, then the NHS is ready to roll it out, and the NHS will deliver the vaccine into people's arms as fast as it can be produced. It's not a simple product. It's a biological substance. It's not just a chemical that you make, and so that is a complicated process. And I'm confident, though, that the NHS will be able to deliver these shots into people's arms at the speed at which it can be manufactured. And I'm also now, with this approval this morning, highly confident that we can get enough vulnerable people vaccinated by the spring that we can now see our route out of this pandemic. It's going to be a difficult few weeks ahead. We know that, and we can see the pressures right now on the NHS, and it is absolutely critical that people follow the rules and do everything they can to stop the spread, especially of the new variant of this virus that transmits so much faster. But we also know, all of us now, that there's a route out of this. And the vaccine provides that route out. We've just all got to hold our nerve over the weeks to come, so until the vaccine can make us all safe.
And that will be by late spring, do we think?
It'll be by the spring, and we can say that now with confidence that we will be able to get out of this by the spring, and we'll roll out this vaccine. We'll get people vaccinated just as quickly as possible.
And in terms of quantity, is there enough, or will there be enough of AstraZeneca to vaccinate the entire population?
Well, yes, we have that on order, 100 million doses. Of course, what also matters is the speed at which that can be manufactured. There's an important other point in the decision by the regulator that's been announced this morning, which is that the time from the first to the second dose is recommended up to 12 weeks rather than the much shorter period that had previously been recommended, having looked at the data from Oxford-AstraZeneca. This is important because it means that we can get the first dose into more people more quickly, and they can get the protection that the first dose gives you. So the scientists and the regulators have looked at the data and found that you get what they call very effective protection from the first dose. The second dose is still important, especially for the long-term protection, but it does mean that we'll be able to vaccinate more people more quickly than we previously could. The MHRA, who are the regulator, will be setting out more details of these clinical points later this morning. But all of this is good news for how we can get this country out of this pandemic. And actually, it's good news for the whole world because this vaccine is relatively cheap to produce. Because it's relatively easy to handle and just can be stored at a normal fridge temperature, that means that it can be used right around the world. And I'm just so proud of the team at Oxford University and the UK Vaccines Network, of the National Institute for Health Research, who funded this, the NIHR, and the team at AstraZeneca and the NHS, who've really made this happen. It's been a big collaborative team effort, and it's very good news for the whole world that the UK can bring this vaccine that so many people around the world will be able to take and get protection from this dreadful disease.
Just wanted to ask, because now there are two vaccines online, will it be possible for people to have two doses of different vaccines? In effect, is it possible to mix them or not?
Well, that is not the approved approach. The approved approach is that you have two doses of one or the other vaccine up to 12 weeks apart, those two doses. And obviously we're going to stick rigorously to what has been approved by the regulator, having looked at the data at the tens of thousands of people who've had this vaccine in the trial.
And do you know what the efficacy is after one dose and then after the second dose, how it increases?
Well, the regulator is going to set out all of those details later, but what the clinical advisors say is that the Oxford-AstraZeneca vaccine is very effective from around 2 weeks after the first dose. The second dose is still important for the long-term protection, and that's why this remains a two-dose approach. But the gap, the window between the two doses of up to 12 weeks is very effective, very helpful at allowing us to vaccinate more people more quickly than we previously could have done.
Just very quickly, before we move on, because there now will be a choice, are you worried that people might prefer one vaccine over the other and hold out for that particular vaccine? Have you put anything in place to ensure that that doesn't happen?
Well, in order to get your vaccine, you should wait for the NHS to contact you, and the NHS will decide what is the most appropriate vaccine for you. But the good news is that both vaccines are very effective. And all that data will be set out by the regulator later today. But people should come forward whenever they're asked by the NHS, according to clinical need, not ability to pay. In the long-standing tradition of the National Health Service, of which we're so proud.
You'll be aware that Essex have declared a major incident this morning, saying that hospitals can't cope due to staff sickness and critical care bed capacity. What will you say to the doctors there? How are you going to help them now?
Yes, well, this vaccine news is so important because in the short term, in the weeks to come, we've still got a very difficult problem to deal with, and all of us need to play our part. Every single person, not just in Essex, but right across the whole UK, needs to do their bit to reduce social contact so that they don't pass on the disease, especially because 1 in 3 people who have this disease have no symptoms at all but still pass it on. And so in Essex, we've been monitoring that very carefully. There's clearly significant pressures on the NHS. So if you live in Essex, then it is absolutely vital, even more so than elsewhere in the country, that you have no social contact unless it is absolutely necessary outside of your own household. And this is important to protect your NHS locally, where the NHS, the local authority are working closely together.
It's obviously worth giving that advice to prevent the health service being overwhelmed. But they're actually saying that that is happening now. It's not something into the future. They're describing it, one group of doctors saying this morning that the NHS is facing its darkest hour.
Yes, it's a very challenging situation. Of course, one of the advantages of having a national health service is that we can ensure that support comes for those areas that are under pressure from elsewhere across the country. So I know that, for instance, the NHS in Cambridge is supporting the NHS in Essex, and that we've done that as we've seen peaks of this virus in different parts of the country. So we've been able to bring in support from elsewhere. But that doesn't take away from the fact that we are facing a very significant challenge in the NHS right now, and everybody can play their part in helping to protect the NHS now. And even more so, let's protect the NHS now by following what we all know we need to do, because it's only a few weeks until we will have the vaccine delivered to enough vulnerable people that they will have the protection from the vaccine, which is the route out of this pandemic. So let's hold our nerve. Let's all do what's necessary. Of course, we have those Tier 4 restrictions in place in Essex, and everybody should in Essex and in Tier 4 areas needs to stay at home unless they absolutely need to, unless they have a reason for which they have to leave their home.
Before we move on to the tiering system, many will be asking about the Nightingale hospitals and why they aren't being utilised. They were built at great expense, millions of pounds spent on them. They've hardly been used, and now we're being told that they're being dismantled.
They're not being dismantled. They're on standby, and they are there in case they're needed. Now, the other thing that we've done over the summer is that we have built more capacity within the NHS. We've physically built on additional critical care capacity, and the best place to be treated if you are a COVID patient is in a hospital. But of course, the Nightingales are there in case they're needed. So absolutely.
But forgive me, the medics are telling us that the Nightingale hospitals may be there, but there's simply no staff to run them. They seem to be white elephants.
No, that's not true. There is a staffing model.
What the doctors are telling us isn't true.
Well, I'm telling you what the doctors who actually run these things are saying, and of course they're there. But the thing that we all the thing we're all working on is obviously to support the NHS to look after patients in hospital, and then to have the Nightingales as backup should that hospital space fill up completely. But the first and the best place to make sure that we treat patients is in hospitals where they have everything on site. And then we will absolutely have the Nightingales. We do have the Nightingales on standby as backup if that's necessary. But of course, we need to staff the Nightingales, and that requires people to be brought in from elsewhere in the NHS and from outside in order to make that happen.
Let's turn to tiers, tier 4 being the highest. What more are you going to do today? What more can you do aside from a full lockdown?
Well, you'll have seen that there's been a significant rise in the number of cases. The highest number of cases recorded yesterday, 53,000 cases. And so we are going to have to take further action. I'm going to set that out to the House of Commons later today. I don't want to preempt what I've got to say to the House of Commons, but I think everybody understands how important it is to take the action that's necessary to keep this virus under control. And, you know, throughout our strategy has been to suppress the virus until a vaccine can make us safe. And now we have not one but two vaccines that are ready to be deployed to make us safe. It makes it all the more important to suppress the vaccine whilst we get through the next few winter weeks until we can have enough people protected.
To suppress the virus. Very quickly, because I know you do have to go, can you clarify the situation on schools reopening next month? What is the scientific advice that you will be following? What are you going to do?
Well, there's further meetings to finalise that decision later today, and I'm sure that the Education Secretary will want to set out the details of the approach that we're taking. Clearly, protecting education and children's education is incredibly important, and we've tried to do that throughout this crisis since the first wave. And the challenge is how to do that in a way that minimises the impact on the spread of the virus.
But it's very late with schools going back in a matter of days. It's very late to be making this decision, isn't it?
Well, of course, one of the challenges in a pandemic is that you get more information all of the time. And this new variant of virus is really, really tough to deal with. I mean, it makes the strategy of suppressing the virus until a vaccine can make us safe. You know, the vaccine bit has just got a whole lot better with the approval this morning, but the suppress the virus bit has got a whole lot harder since the new variant got going over December. And now the majority of new cases in the UK are the new variant. It is much, much easier to transmit from one person to another. That's why it's spreading so much faster. So the challenge of suppressing the virus has got harder, but thankfully the cavalry have arrived in terms of not one but two vaccines, and we've got to get those into people's arms just as fast as they can be produced.
Final thought, do you support the idea of a circuit break in football as suggested by Sam Allardyce today?
Well, I think it's fantastic that we've been able to keep football going since the summer. It's so important, and it's absolutely a matter for the football authorities working with the Culture Secretary to get this right. I'm not going to get involved in that discussion. I know how seriously the football leagues take the need to keep people safe, and how seriously they take the measures that are necessary. And I know that they'll be taking this decision very seriously as well. But I also know just how great it is that we've got football on the telly, and we're managing to do that behind closed doors, even in the teeth of this pandemic.
Matt Hancock, thank you very much for speaking to us this morning.
Thanks for having me on.